Hello, I'm Dr. Abhay Chopda, and I am experienced in both gastroenterology and surgical practice. For athletes and sports enthusiasts, few injuries are as frustrating and potentially career-threatening as athletic hernias. Often misunderstood and misdiagnosed, these injuries can sideline even the most dedicated athletes. Today, we'll explore the intricacies of athletic hernias, from diagnosis to treatment, and the crucial process of returning to sports safely. Athletic hernias, also known as sports hernias or athletic pubalgia, aren't true hernias in the traditional sense. They involve strain or tear of soft tissue in the lower abdomen or groin area. These injuries typically occur due to sudden twisting movements, repetitive motions, or intense exertion. High-risk sports include soccer, ice hockey, football, tennis, and track and field, particularly for hurdlers. Understanding these factors helps identify athletes at risk. Diagnosing athletic hernias can be challenging as symptoms often mimic other conditions. Key symptoms include chronic, deep groin pain that worsens with exertion, pain radiating to the inner thigh, and tenderness in the lower abdominal area. The diagnostic process involves physical examination, where doctors assess the painful area and observe specific movements. Imaging studies like MRI, ultrasound, and X-rays help confirm the diagnosis and rule out other conditions. Treatment options vary depending on injury severity and individual needs. Conservative treatment includes rest, physical therapy, anti-inflammatory medications, and ice therapy. For cases that don't respond to conservative treatment, surgical options include open surgery, laparoscopic repair, or mesh reinforcement. Each approach aims to repair the damaged tissue and restore function. The choice of treatment depends on factors like injury severity and athlete requirements. The journey back to sports follows a predictable yet individual timeline. Athletes often progress through distinct phases of recovery, from initial rest to full return to competition. Early success in basic movements builds confidence for more complex activities. The body's healing process requires patience and proper progression through each stage. Understanding these milestones helps athletes maintain realistic expectations during recovery. Athletes develop a new appreciation for proper training progression during recovery. The body adapts remarkably well when given appropriate time and support. Many discover stronger core muscles and better body awareness through rehabilitation. Prevention becomes a natural focus after experiencing this injury. The lessons learned during recovery often lead to improved training habits and injury prevention strategies. Think of athletic hernia recovery as your personal sports movie montage, just a bit longer than the Hollywood version. While you might not have dramatic background music during rehab, every small victory brings you closer to your comeback. Even professional athletes have to start with the basics. Imagine a soccer star practicing their walking before their sprinting. Remember, slow and steady doesn't just win the race, it gets you back in the race. Recovery follows distinct phases. The early phase focuses on rest and gentle movements, progressing to strengthening exercises and flexibility training. Advanced rehabilitation includes sport-specific training and gradual return to practice. Following your rehabilitation program strictly, listening to your body, and maintaining proper form are crucial. Core strength maintenance and proper warm-up become essential habits for long-term success. Your athletic journey is as unique as you are. By staying informed and engaged with these various resources, you're not just recovering, you're preparing for a stronger comeback. So keep reading, keep connecting, and keep following your recovery plan. Until next time, this is Dr. Abhay Chopda, reminding you that when it comes to athletic hernias, knowledge truly is power. Happy healing, and here's to your successful return to sports.